Hi there. So my name's Kejia, and I'm a technologist working at Clover Health. We are a health insurance startup focused on the Medicare Advantage population. And what we're trying to do is create a different kind of health insurance company, one that actually improves the health of our members. And today I want to talk to you about how we're using technology and data to empower our frontline staff to deliver targeted and measurable interventions for our population. So as I said, we focus on Medicare, and that means our membership base are the poor and the elderly. These people living with multiple chronic conditions and face an array of psychosocial issues that impact their health. To put it bluntly, these people, affecting their health is extremely complicated. And to be honest, an app on their phone or a step tracker is really not going to make a meaningful impact for this population. The challenge that we face is how to navigate the complexity of their care. Now, these are people seeing multiple doctors, going to urgent care clinics, hospitals, and different pharmacies. Each of these actors has a different piece of the puzzle, but there's no way for them to bring it together into form a coherent picture of that member. And as a result, it creates a lot of gaps in care. And simple gaps such as members not being able to pick up their medication or not getting a timely preventative screening on time. And those gaps are probably the single greatest leverage point for improving the health of this population. And that's really why we started an insurance company. Not because we wanted to make insurance itself better and more efficient, but because as the insurer, you actually have a great deal of leverage to improve care. You do this because you actually interact with everyone on that care continuum. And as such, you can have a more complete picture of that member and start influencing how that care is delivered. And we've done that by building a technology and operational stack that allows us to take information from labs, hospitals, pharmacies, to build that complete picture and then deliver it to our frontline NPs, social workers, and even customer service agents to then deliver the care that the members need in a timely manner. In essence, we've built a feedback loop where we take data in, we perform an action, and then we measure the outcome of that so that we can do the whole thing better. An example of this is our missed medications program. Using pharmacy claims data, we know the medications that our members are on, we know when they're supposed to get a refill, and most importantly, we can identify when they forget to make that refill. Our system triggers a customer service agent to reach out to a member whenever we detect this happening, and we call them to find out what's going on. But this is more than just a simple reminder call. We've armed our agents with context about the medications that our members are on, the pharmacies they're going to, and how much they're paying, so that we can start addressing some of the root causes of why people aren't filling their medications. In one instance, we called a lady who's living alone and was on 3 different types of critical medication to manage her diabetes and cholesterol and heart disease. What we found out was she didn't pick up her meds that month because she couldn't afford the copay. Our agent was able to see that she was going to a non-preferred pharmacy, and if she'd actually switched to a pharmacy about 10 blocks over, she'd be able to get those medications completely for free. And on that call, she was able to make the transfer, and the next day the member got the meds that she needed. More than that, this simple little intervention has removed a future barrier for this member staying healthy. And that's just one example of the many ways we can intervene. This particular pilot program we ran, and we saw an 18% increase in the fill rate for members who had lapsed in their medication. And this is now a program that we've rolled out across our entire population. Another example is our nurse home visit program. Clover employs nurses that we send to members' home to perform medical screenings, but also to assess what their social circumstances are. Are they dressing themselves? Are they able to feed themselves? What we do is we arm the nurses with our Clover iPad app, which allows them, when they walk through the door, to have a 360 view of everything that we know about that member. Now, instead of going in cold, they have all the information that we, as the insurer, knows about that member. More than that, the app creates a customized assessment for that member, which means if the day before we got lab data that they have an abnormal A1C, the nurse is now directed to perform a more in-depth diabetes screening for that member. And this kind of tailored intervention has allowed us to capture more undiagnosed conditions. Using the CMS risk-adjusted factor score, we can see a 5-time increase in capture of undiagnosed conditions compared to a simple generic paper-based assessment. And this is a program that, again, that we've been able to roll out to our entire population. Both of these programs were incepted, tested, and rolled out in the last 12 months alone. And we're addressing additional points on the care continuum. We have pilot programs aimed at improving the post-discharge program, as well as programs where we take the information that we have and feed it back to our members' physicians so that they have that 360 view and can play a part in the broader care coordination. Now, what we've done, we're not coming in here with some grand unified theory of how to treat diabetes or COPD. What we've done is used technology and an operations stack to build this virtuous feedback loop that allows us basically to learn what works faster and then use that same stack to scale it across an entire population. And in doing so, we learn even more about what works and can just keep building on that cycle. And in doing that, we're able to use technology to really create a health insurer that can make our members healthier.